Well, thank you so much for coming out in the rain. I know that, especially for us Bay Area people, for the last 2 years there's been a drought, so we don't know what to do in the rain. Katie is equipped, coming from Seattle. She's like, what? She's ready to go. Yeah, so for those of you who don't know, I'm Sandy Rayner. I'm one of the co-founders and I lead operations for HandUp. We're a fundraising software for human service nonprofits. So we specifically design fundraising tools for this audience and help organizations fundraise online. We've raised about $1 million to date, working with some of the organizations here tonight, and are just excited to continue to serve this amazing community of people who are so passionate about ending homelessness. Tonight we are obviously in the spirit of the National Conference to End Homelessness. Raise your hand if you're going to the conference or a part of the conference. Oh, okay, so we do have a few, and then we have a few folks who didn't raise their hands, so I'm glad we got a few folks who are just in the community and a little bit of diversity here. We tonight are really focused on this issue of family homelessness. Particularly in our role at HandUp, we are broadly reaching out and trying to get more of the general community involved in giving to homelessness. And people are like, family homelessness? Does that really, I just, people picture the Vietnam War vet who's pushing a shopping cart and don't realize there's actually I just read a statistic that there's 2.5 million children in America, so that's 1 in every 30 children who will go to sleep in a given year without a home of their own. So it's actually a huge, huge problem. And so tonight we have some awesome panelists with us who are going to help us just learn more about this issue and hopefully open it up to the audience as well. So here I have Katy Miller, who's with the U.S. Interagency Council on Homelessness. They're an awesome organization that works to foster partnerships among 19 federal agencies with the aim of ending homelessness. Katy has, I was reading everyone's bio, everyone has multiple decades of experience, so I feel very humbled to be able to dig on the knowledge of each of you. But Katy's been working to build national partnerships in this area specifically and brings that perspective of how is the government playing a role? What are we looking at nationally around these issues? Jessica Delaney represents Abode Services, and she leads resident services for their permanent supportive housing programs. And Abode has just been an awesome partner of HandUp. We are always at the same conferences, it seems. And they've been nationally recognized for a lot of their work in Housing First and kind of innovative funding models, so excited to hear more from you. And then Aimee Armata is the Chief Program Officer for Bay Area Community Services, lovingly known as BACS. They've also been a HandUp partner, and I'm really excited that Aimee joins us tonight because she brings deep expertise in looking at youth homelessness specifically. So it really helps to sort of round out that perspective for us. So I guess I'll really start with you, Katy, because you have that sort of national lens, and just sort of framing where we're at right now in homelessness and homeless families specifically, and also looking at, how did we get here? How did this become the problem that it is? And obviously that's a very big question, so you can sort of chew off some of those key barriers that you see of what the situation is today.
Sure, I'm glad to be here. I want to introduce two of my colleagues, Amy Sawyer and Bob Holster, who are also here from USICH. There are 5 of us that cover the whole country, and so I cover a lot of the West Coast with Amy, and Bob's on the East Coast, based in Boston. So I live in Seattle, Amy lives here in San Francisco. So we're very glad to be here with you. We're excited about this type of organization and the partnerships that are being created here. And so the question about, I think, what's happening nationally, if you're not paying attention to what's happening with with President Obama's budget that just went through around family homelessness, I really ask you to take a look at that. He proposed $11 billion to go towards ending family homelessness over the next 10 years, and it was put in the side of the budget that is a mandatory side of the budget. So a lot of funding that goes into the federal budget is on a discretionary side of the budget. It's on the mandatory side, and this has not been done before. And the level of attention, the level of interest around homelessness in general, around chronic homelessness and youth homelessness and family homelessness is unprecedented. So if you haven't looked at that, take a look at it, and just really important. How we got to the crisis that we're in is a harder question to ask or to answer, which is, there are a number of issues. Housing affordability, so living on the West Coast, you know that housing affordability is a huge piece of what we're dealing with. Access to mainstream systems that are navigable for households who are in crisis, that are geared towards people who are going through trauma and are linked up in a way where they're seamless, where someone can get the resources they need when they need them. All of those issues come into play, and at a federal level, as Sammy mentioned, there are 19 federal agencies that we're working on coordinating, and all of them work within their own silos, and really bringing those agencies together in a way where we can break down those barriers so that we are working together, we're talking together, we're using common language, and we're leveraging each other's resources to move more rapidly, and we're seeing some real change. But again, look at the president's budget for sure.
Yeah, and on that, exciting to see, I don't know if you saw the announcement that San Francisco is working on bringing our different agencies under one Department of Homelessness. Actually, Emily Cohen from that team is here. I just put you on the spot. But yeah, it's so important to get that collaboration across departments.
Yes.
And so exciting that Obama has, first with veterans and now with families, continued to push. And so I guess my kind of turning to you, Jessica, would love to look at that in context to the Bay Area. We obviously have our own challenges here, and would love to just hear from you, just deeper of how these issues are impacting us here in the Bay Area, and even I know some of the great work you're doing at Abode.
Thank you. So Abode Services started about 25 years ago with just a small homeless shelter in Fremont, and now we have 175 employees and at my last count, 40 programs across 4 counties in the Bay Area. So we've grown quite a bit over the last, most of that growth happened in the last 6 years because the housing crisis has gotten so much more difficult to deal with, and a lot of more folks being pushed out of their housing. So we work really hard to try to be creative with housing solutions because it's so expensive to build permanent supportive housing, and it can take 5 to 7 years from the time you start talking to the city government about purchasing the land until you get everybody on board to actually make it happen. We're trying to work with other local city governments to work around some other temporary housing that could potentially eventually be permanent housing, and just getting a little more creative with it. We're doing a lot of rapid rehousing in the Bay Area. I'm not sure, I'm assuming folks are familiar with that. It's pretty, the statistics nationwide say that it's a really successful program. We've had over 77% success in exits to permanent housing from rapid rehousing over the last 4 years in our program. So it's a great program that provides a little bit more temporary assistance for folks who just are mostly able to stabilize on their own with the appropriate supports. We're really excited to be opening a brand new permanent supportive housing complex in Fremont. The applications will be coming out on March 1st, hopefully, if you want to refer folks. Yeah. That's going to be Laguna Commons. It'll be 63 units of permanent supportive housing. We'll have 25 VASH vouchers there, so Project Think Section 8 for veterans and their families, and then we'll have some continuum of care units for folks specifically referred from behavioral health care services, and then the remainder will just be for homeless families that are, below income, without giving you too much jargon. Around 30 to 50% below AMI for the area median income, and then we're taking possession of motel in Santa Clara. The city of San Jose has asked us to take over the Santa Clara Inn. So there will be 27 permanent units there and 29 hotel units, which essentially will operate as transitional housing, primarily for folks who have already identified housing, but maybe they've timed out of the shelter, they can't stay there any longer, or there's some other barrier before they can get into their temporary housing. That's going to be a maximum of 28 days stay for folks. So, you know, we've been doing a lot of collaboration with the county and the referral agencies to make sure that folks are exiting from there into permanent housing. I mean, I could go on and on and on, but I don't want to take up too much time, so.
No, that's really helpful to just sort of frame where we're at here. And I think even one thing I'd be curious, you know, is we obviously don't have, and we don't have enough housing stock. And I'm curious just how is that for you impact-wise of like San Francisco pushing into South Bay, it seems like this sort of merry-go-round. And yeah, just curious, you know, what strategies, obviously you're doing a lot to build more housing, but are you seeing, how are you seeing, I guess, folks that come to you? Are you able to house most of the folks who come to you? Are you seeing a lot of folks referred to you from other parts of the Bay Area?
I think it varies. It's really difficult. One of the very local trends that we're seeing right here in Oakland is folks being pushed out and the rents continuing to go up here in Oakland. It's no longer affordable. This used to be one of the cities that we could almost always find somebody a Section 8 unit to house them in if we could get them a voucher, and that's not the case anymore. You know, apartments in East Oakland are going for $2,300 a month for a 2-bedroom. Where, you know, I mean, it's just becoming increasingly and more difficult. So that's sort of like a major trend that's happening right here in the city of Oakland. But you know, overall, I think it's just going to continue to be a challenge. We're encouraging a lot more folks to get creative with the household size. Folks are having to move in with roommates, doubling up, bringing additional family members in. Obviously, we don't want to encourage overcrowding of units, but if folks don't want to be exported to other communities, you know, north or south of here, then we have to come up with creative solutions and work with what we can.
Yeah, thank you. And on that, I guess, Aimee, question for you is, you know, how does that look for youth specifically? And I guess beyond just the like logistics of how do you house people, you know, how does that impact youth specifically?
So, hi, I'm Aimee. So I think what I want to focus on is like, what's the experience young people are having and the relationships that they need to build with homeless service providers in order to not kind of get shredded by coming into care relationships. So, no, that sounds a little intense, but so like what I think about is, so young people, right, developmentally, like they have to form a bond, right, with their primary care provider, whoever that is, to survive. And that drive is what's more powerful than that. So young people will do anything almost to preserve their primary care relationships for survival. So imagine what's happening for them in their homes and their communities, that they would sacrifice that in order to try to preserve their integrity by leaving. And I mean, just kind of connecting to that on social justice, a mental health, relational level. I think like if that informs how you show up in relationship to young people who are coming into care, and as, you know, just to keep it real, like as those of us who are providers know, sometimes our systems can really replicate the environments that young people are leaving, right? So they're leaving chaos, neglect, lack of responsiveness, and, you know, what's it like at a homeless youth shelter? And then what I want to add to that is really, really addressing the needs of LGBT youth. There's a huge disparity of LGBT young people in the homeless youth community. About 40% of homeless young people identify as LGBT. Shelter services are not awesome for those young people. So we definitely want to think of what does it mean to have, and I think this conference, in fact, a few years ago focused specifically on this. So what does it mean to have welcoming, inclusive, affirming environments for LGBT young people? There's also a toolkit, I think, also put out by this group around trauma-informed organizations and kind of a map of how to assess for that and do that in a real way. So want to flag all of that. And then the number one reason why young people who are homeless don't come into care relationships is, like I said, for the very reasons they left, because they're afraid of the system that's designed to care for them. So it's like if we live with that paradox and take that seriously, how would we change how we're providing services, tomorrow? And then, of course, the criminalization of unaccompanied minors. I mean, what's really available for them? So how can we partner with, with governmental and local agencies that can do something else for young people other than send them to kind of the receiving center and calling CPS. Also really understanding what is the social and developmental need where we're seeing criminal activity. So young people that are engaging in basic survival every day, how are we looking at how that's adaptive instead of, a crime? We may put them at increased risk. And then to really understand the level of exploitation and violence that young people are at risk of on the streets. And again, LGBT young people, they're 7 times more likely to be assaulted on the street than their heterosexual homeless peers. And then also think about specifically in the Bay Area, the disparity of youth of color, and that youth of color are much more likely to get services in highly restrictive environments, like emergency rooms or hospitalized. And then that leads me to kind of what does it mean to have staff that are culturally responsive to then this intense disparity in terms of the homeless youth that we're serving, who are LGBT, African American, Latino young people. How are we meeting them where they're at linguistically, adaptively? How are we involving them in designing our services? So those are some of the things I want to highlight. And also then the young people that are exiting these systems of care are also predominantly, a cause of youth homelessness. So young people are exiting care, they're running away from care because they're not optimal environments for a growing young person, and without income, and with interrupted education, right? So if you're kind of on the streets and then in juvenile hall and then in a group home, your education is deeply, deeply impacted by that. So my question is, where is the dedicated homeless youth education and employment provider? I mean, some people do some stuff there, but it's there isn't a coordinated effort around that in Alameda County. And then I think I'll stop there. And we'd love to talk about labs too.
Yeah, no, I mean, it's so important to frame. And I think, something that is of interest to me is how do we prevent the youth from getting there? Because obviously, if your home is broken to start with, the likelihood of falling into homelessness yourself later in life is going to go up so much. I was reading a statistic that estimates the change of relationships, so divorce or breakup, triggers homelessness 10% of the time nationally. Specifically after divorce, 40% of women are in worse economic circumstances and are 3 times as likely to live in poverty after some kind of change in the family structure. And so one question for you, Jessica, is you see families every day who are at this kind of economic brink, and just curious, you've talked a little bit about this with teaching families how to live together, or what are some strategies that work that help hold that family structure together?
It's not an easy answer. It's very complicated.
It's too hard.
Take it away, Jessica.
Yeah, I know. Let me solve this problem in 3 minutes or less.
And just
I think, improving the shelter services, I definitely agree. Making people feel safe when we're providing those services, and the more that they trust us and we can help them to navigate these very complicated systems that sometimes I don't even understand, and I'm in it supposedly doing it every single day. And it gets overwhelming for me, so I think just understanding that difficulty and helping people to know that it's okay, you know, that it's difficult and we're gonna help you through whatever we can. I think one of the hugest barriers is that folks oftentimes have to fit into a very specific box in order to get the funding for the particular housing that we actually have available. And if you can't check off those boxes, then unfortunately the government or the feds or whoever's giving us the money just kind of ties our hands and you know, if you're not a veteran, we can't put you there. If you don't fall below this particular income, you can't be there. And sometimes we don't always have a place that we can send folks, which is where we're always trying to develop new programs like rapid rehousing, which does allow us to help more families to stabilize quicker. So, you know, it's a complicated issue, I'm sure that everybody understands. But I think making the services acceptable and welcoming, accessible is one of the biggest things. And providing the really highest quality of service with best practices every single day gets people to keep coming back. And sometimes, you know, we need them to show up so that we can show up and try to help them, you know, overcome the barriers.
I think just to add to that, something running a family shelter in Berkeley is the real need to welcome fathers and men with children, single men with children. So there's not a whole lot of emergency shelter access. And then to have kind of child development focus to support the family, to really work with assessing the strengths of the family, even though there's, you know, vulnerabilities there. So really, you know, leveraging what's already healthy, what's already working, and like building resilience. And then just a plug for, you know, childcare services connected to family housing and rapid rehousing, and looking at some of the evidence-based practice that specifically meet the needs of children of color, which is really different. So being very aware of our own biases and worldviews when we assess like what a family needs to look like. So there's a lot of work that needs to be done there to have an effective outcome in terms of families getting permanent housing.
Yeah. So we've gone maybe we got too dark because. So I want to turn to Katy for some hope and inspiration. You've already mentioned Obama and that being an exciting kind of on the horizon for us. What are other solutions that you see working? Maybe even examples of specific communities who've made some significant strides, and what's sort of some models that are working?
So there are a lot of exciting things going on. I think communities, well, let me just say, for the first time in history, we've ended homelessness for certain populations. And so we're not here to talk about veterans, but incredible 22 communities have declared an end to veteran homelessness. And it's something that we've never done before. And the way that we did that is we created certain systems to target resources. We had government, so federal, state, and local organizations working together in ways that we've never seen before. And again, targeting resources to those based on their individual needs and moving quickly to place people into housing right away and really gearing it towards a housing first model. And so all of these things, finding lists, doing aggressive outreach, coordinated outreach, finding people, and again, moving them straight into permanent housing. So I think it's now 2 states that have declared an end to veteran homelessness. So what we have learned from that is that we can do it. If we organize ourselves in a way, and we have the federal resources that which is the key piece of this, and again, using them in a way that we can leverage the local dollars and the state dollars to move quickly. So that lesson can be translated to other populations, and what it's done for government and for other leaders in the communities is it's been a proof point. It said that something that we thought was intractable actually can happen. And if we can start translating that for other populations, for youth and families, which again, if we're able to get the federal resources, that again, we can leverage the other flexible dollars and use them in a way where we can move rapidly together, then we're going to make change. And again, we've never done it before, and it's very exciting time. And I think communities are geared up to do that, and again, local leaders are geared up to do that. I know I've been meeting with Mayor Lee recently and other mayors up and down the West Coast who are very interested in this issue and wanting to make change quickly. So very exciting time.
Well, I want to open it up. If anyone has questions in the audience, feel free to raise your hand and introduce yourself. Yeah.
My name is Liz. I work in San Francisco. I have a question. What's your view on the economy? As we know, the economy is getting better, more government getting more revenue. With the economy, it's good and bad because the housing prices, the cost of rental units, been pushing poor people and low-income people to even afford and more dire homelessness. The good thing is we actually get donations, millions of dollars. What's your view on the economy and how we should prepare ourselves to find more opportunities or to make the most of the situation?
So I think, when we talk to local leaders about ending homelessness, we talk about the short-term crisis plan, but we also talk about the critical need to have a long-term plan. And so if you don't have an affordable housing plan happening at the same time that you're dealing with the immediate crisis of homelessness, people sleeping outside, you're not getting anywhere. And so the affordability crisis that we have, especially on the West Coast, is a huge issue. And so again, I was in Portland, Oregon in December with 5 mayors from the West Coast, so LA, San Francisco, Portland, Seattle, and Eugene. And all of the mayors were talking about affordable housing with the HUD secretary. And the president has this on his radar screen, but again, if we don't have a plan in place, then we're not getting anywhere. So that pipeline of affordable units is critical. And looking at also different strategies for what housing looks like. So shared housing is definitely something that's being looked at. Zoning is another issue that's being looked at, and density. In Seattle we have a lot of single-family homes. We don't have a lot of density, but in these communities that have booming economies, a lot of companies coming in. I think it was in Seattle, we had 90,000 people moved to Seattle last year. I mean, how is that? The competition is great. We have a 1%, 2% vacancy rate, which I know you have here in San Francisco. And so all of these things need to be addressed on many different levels. But if without a plan in place, we're not going to get any better in the future.
Yeah, and one thing just to tag on to that, obviously, from the federal level, the long-term plan and is very important. Also looking at, where are the gaps in funding, and one thing that we've seen with HandUp is with the, economic boom and a lot of press going to big tech companies, what are you doing? What's your response? You're creating, the finger is getting pointed. And so we have certainly, seen that in some ways create a positive where we're able to form new relationships for the nonprofits that we work with to help draw more funds toward these issues. So I think definitely trying to steer that kind of narrative in the press and say, hey, all right, if you want, to look good and you're doing so well, here's how you can, give back to the local community. That's definitely something HandUp has been trying to play a role in.
I think also, I hear in my work at least once or twice a week about a new project that's coming online, or someone's trying to fund a new development, and then the following week something happened in the appropriations and then it got killed, and then 2 weeks, a month later there's 3 other things that are coming down the line. And I think the more community support that local governments hear from the people who live in the community, that it's a priority for everybody and you need to approve the affordable housing developers to build that housing in my backyard right next to my house and just make it a priority for everybody. Because we get a lot of pushback, especially in the higher, the more expensive areas, in the Tri-Valley, down farther south. People don't want us to build affordable housing next to their community, and it actually brings more economic development to the entire community. People think it's going to be a blight on their, neighborhood, but it actually brings more jobs and it brings more money to the community overall. So the more that we can sort of spread that word and get people to talk to their local governments, I think it makes a big difference when you show up to the city council and people are trying to knock it down and you stand up and you say, no, I want this development in my community. I think it makes a huge, huge difference.
Eric, question?
Yeah, actually related to that point, I'm Stan. I live a few blocks away, not really part of any organization. So related to people's perception, not mirroring reality, it seems just talking to people, most people think that the homeless population mirrors those that you see, say, on a Market Street in San Francisco, which is clearly not the case. Sort of, how damaging is that perception, and what are we or what can we do to change that perception?
I mean, I think HandUp is a great organization that tries to do that every day by putting a different face to folks that are homeless and sort of getting the word out that there are a lot of different types of folks that experience homelessness, whether it's chronic because they have a significant persistent mental illness. That person is going to look different than somebody who lost their job and used to live right next door to you and now they can't afford it anymore. So I think, I don't know the answer.
Yeah, I'd be curious, maybe you can share like some of the stories that you have put on HandUp. Put you on the spot
I
here.
guess I would probably defer to Pamela. She's one of my coworkers who's in the audience, and she's had some really great success with some of her folks on HandUp that just need basic things like, dental work so they can go back to work so they can feel confident in an interview because their teeth are fixed. Or, they've been sleeping on an air mattress. Even though they've been in permanent housing for 2 years, they've been sleeping on an old ratty air mattress and never even told us that they needed a bed until we said that HandUp was available, and then were able to fundraise on their own. And it's really empowering for folks because a lot of folks don't want you to give them a handout, and they don't even want to tell us that they have the need. They're like, you gave me the housing, that's enough, I'm just going to be quiet and stay in my unit. And I think it's really unfortunate because there's a lot of negative sort of connotations of that. So I think that HandUp has really helped us to meet some of those needs and fill in some of those gaps in our agency, and we're looking forward to doing some campaigns as well to do some broader range fundraising.
I just wanted to also answer your question a little bit about, I was talking to Megan earlier about how to change people's perception of what homeless actually looks like. And HandUp's doing a beautiful job of doing that, just by the profiles they feature, but also engaging companies, bigger companies to participate. I know at my agency at Abode Services in Fremont, they do a lot of corporate, Boston Scientific. I don't know. I'm not really at the shelter anymore, but they used to have groups come in and serve meals and interact with the residents and get an actual feel for what this is what homelessness looks like. It's a family with 3 kids, an intact family, and I think just exposing larger groups, and HandUp has a really good way. I mean, since they're engaging big companies and trying to draw them in to donate, connecting them with us, with the CBOs, with the shelters, with facts. However, whatever that looks like, just engaging people. Most people, all they need is just a couple times. They just need to see it for themselves or participate in a volunteer activity or something like that. I think most people that open up their hearts and then that kind of spreads. That one person says, "Oh wow, I just went volunteer to the boat today. It was an awesome experience." I think it kind of. I think you guys can really do a lot to change that, even more than you're already doing, just by engaging your donors.
Yeah, definitely.
Send them our way.
Thank you.
I'll give you sure. I mean, residents are always willing to talk to people too, eager to, engage.
And that was exactly my point. So I just heard today, so we run wellness centers throughout the county, and we're kind of brainstorming, like, how can we really be in touch with the community needs, because they're different, they serve very different communities. And everyone said that when the participants actually went to speak at, city council, board of supervisors, went to do presentations like this.
Yeah.
Obviously not preaching to the choir, but, a little bit more of a diverse audience, but that makes such a tremendous impact. And then it just conceptually reframes where folks are coming from, and it humanizes, and that there's a continuum, right, of need and support. So the person camped out on DeBose, that's someone who might be at the most extreme end of, the continuum. So that's really effective, that having folks that have participated in the service kind of speak about it.
Right.
Yeah, get those voices at the center is really crucial. That's an awesome question. And we have one time for one more question if anyone else has a question.
Thanks. My name is Jimmy Pete, Power of Choice Consultants. Most recently, my most recent full-time job was as a Director of Parent Engagement Services, working with Alameda County, doing family reunification work. And one of the ways that they begin to work with accessibility problems, culture, interface problems, was by hiring the parents who themselves went through the system, having lost their children, who themselves went through the system, got their kids back, went through training, and then became the advocates who were themselves the mentors and teachers for the parents coming into the system. And they were the teachers for the foster families, who would otherwise have put a lot of religiosity and heterosexual values over some of the LGBTQI kids, who would put a lot of their own neighborhood culture over a kid from a different part of town. So I'm wondering if you have anything like that way of, I've been in social work most of my career, and it's not enough men of color, not enough women of color. More often than not, it's from middle and upper middle class white communities, and largely women. And
yes.
Which
and here we are.
Look, let me say thank you so much for being here. Thank you so much for being there. Somebody needs to. But do you have any efforts? Are there any efforts out there to open the door wider and to have someone on the side of service to meet the side of the client?
Amazing. I mean, I agree with you 1,000%, and I just want to say peers. So peers and advocates are a core part of the BACS model. And in terms of outreach and engagement and facilitation through a transition, a tough transition, you need peers. I think it's the most effective intervention. So I'll just say that.
With our agency, we also do a lot of peer outreach and try to do, for those who excel as peers and are interested in also going to that next level and becoming a service coordinator, becoming case manager, there's always opportunity for that as well, because I agree, they're not going to trust me if I go out into the street or under the bridge where someone's living. They may or they may not, but someone who's been in that experience, and maybe not even culturally, but just somebody who's been homeless. I've never been homeless. I work with folks all the time, but I've never had that experience. So I think it's important that more of us do more engagement on the peer level like you're talking about. I think there are little pockets of it in each agency. I don't think it's as widespread as it should be, because I agree 100%.
And that could be tied to funding. I mean,
Yeah.
it should be tied.
Well, it's absolutely. I mean, the staff we would hire, some of those folks are coming out of CERT being on the dole, as we say. So how do you help a person to think of themselves and become of a different population? Well, each staff had medical care for 2 of their children. There was a lot of latitude for them to make mistakes, learning how to operate in this entirely new kind of corporate business culture. There's a whole lot of things that were folded into the position as a support for the person coming out of one culture and moving into another. And that's funding.
Where was this here in town?
A Better Way is the name of the organization in collaboration with Alameda County.
I would just say that this is one of those things that, to what Katie had said earlier, that you find a silo where it works, like veteran homelessness, and then they can translate to other populations. In New Jersey, where I'm from, we have a couple organizations that provide mental health and substance abuse treatment services that are predominantly, like the organization's commitment is to be 60% of their board and of their staff to be peers, folks who have that experience. And I think that that's from the mental health and substance abuse treatment side, whereas let's apply it to other issues like diversity, like all of those, youth homelessness. Folks who have been there, let's talk about that as the treatment protocol in other silos.
Yeah, well, thank you so much for bringing that question and that perspective. I was actually coming partly from the tech world, very proud of an all-woman panel, but you point out every industry is a little different. But yeah, I am just so honored to have been able to get this knowledge from you all, and obviously so much knowledge here in this room. Lots of folks at the conference, so you can continue these conversations the next couple days. And also feel free to continue. We'll be here for about another 40 minutes or so. So continue to enjoy the last of the food and drinks, and thank you so much for making this your Wednesday evening.